Welcome back. In this video, we're focusing on generalization and maintenance, two concepts that are absolutely central to effective ABA programming and heavily tested on the BCBA exam. At a high level, this topic asks a simple but critical question. Do skills transfer beyond training, and do they persist over time? Acquisition alone is not enough. If a behavior only works during teaching sessions or only lasts while intervention is in place, it has not truly been successful. Throughout this video, we'll focus on transfer, persistence, and effectiveness, exactly the way the BCBA exam frames these concepts. Generalization and maintenance are tested together because the exam focuses on post-teaching outcomes. The BCBA exam is not asking whether a skill can be taught in session. It's asking whether that skill functions in real-life contexts, after teaching conditions change or end. A very common exam pattern is this. The learner performs well during sessions, but performance breaks down in new settings or after fading. The most important distinction to remember here is this. Generalization is about where behavior occurs. Maintenance is about when behavior persists. When in doubt, always ask, is this problem about condition or about time? Let's zoom out and look at the full process. Acquisition means the behavior has been learned under controlled teaching conditions. This usually involves consistent prompts, dense reinforcement, and a specific setting with a trained therapist. Generalization means the behavior transfers beyond that training context, new settings, new people, or new materials. Maintenance means the behavior continues after intervention changes, such as reinforcement thinning or service termination. The exam often compares these stages directly. Questions like, why doesn't it work at home? Test generalization. Questions like, why did the behavior stop weeks later? Test maintenance. Generalization is a condition-based phenomenon. A behavior has generalized only when it occurs under untrained conditions, beyond the original teaching context. This transfer might involve a new setting, a new person, or different materials. But the key is that these conditions were not part of training. Generalization is never guaranteed. It must be explicitly programmed after acquisition. On the exam, you'll often see clues like different classroom, new caregiver, or outside the training session. A common trap is assuming generalization just because the behavior works with the therapist. Without data from untrained conditions, generalization has not been demonstrated. The exam may test specific types of generalization, so it's important to discriminate among them. Setting generalization means the behavior occurs in new environments. People generalization means it occurs with individuals other than the original therapist. Stimulus generalization means the same response occurs across different but similar stimuli. Response generalization means different responses serve the same function. All types of generalization require prior acquisition and deliberate programming. The exam often isolates just one type to test your discrimination skills. When asked what to add to promote generalization, look for answers involving multiple exemplars, new people, or new settings. The BCBA exam rarely labels generalization directly. Instead, it expects you to infer it from context. Key phrases like different classroom, different caregiver, novel materials, or outside the training session all point to generalization. A common mistake is assuming generalization based on a single successful probe in one new setting. That's not enough evidence. A reliable exam strategy is this. If a new person or place is mentioned, immediately ask yourself whether the question is testing generalization. Many exam questions ask, what went wrong? Common generalization failures include therapist dependency, where behavior only occurs with the original therapist, and narrow stimulus control, where responses are tied to very specific cues. Another frequent issue is limited setting exposure, where no variation in people, settings, or materials occurred during training. When you see data collected only in the training context, with no probes in natural environments, that is a red flag for generalization failure, not performance failure. Maintenance is a time-based phenomenon. A behavior has maintained when it persists over time after intervention changes, such as reinforcement thinning or prompt fading. Maintenance is evaluated through follow-up probes, not during active teaching. A key point, maintenance is not about location. It's about whether the behavior continues after support is reduced or removed. A very common trap is confusing maintenance with generalization. If the issue involves time passing, fading, or services ending, you are dealing with maintenance. Maintenance questions include temporal language. Phrases like weeks later, months after, or follow-up assessment are strong indicators. The exam often contrasts these with generalization language on the same question. Never assume maintenance just because the behavior was observed recently. Maintenance must be verified across time with post-intervention data. If a behavior stops after fading or services end, that is a maintenance issue, not a generalization issue. Common maintenance failures include rapid loss after fading, where behavior stops soon after reinforcement is thinned. Another major issue is the absence of natural reinforcers in the environment. Poor programming, such as no systematic plan for fading and lack of follow-up data, are also frequent causes. The exam often tests whether the BCBA anticipated maintenance needs. A classic trap is assuming that continuous reinforcement during training ensures durability. It does not. This slide captures the core distinction. Generalization asks, where does the behavior occur? It is condition-based. Maintenance asks, when does the behavior persist? It is time-based. Exam questions often hinge on this contrast. Why did the behavior stop? Points to maintenance. Why doesn't it work at home? Points to generalization. A behavior can generalize without maintaining. In these cases, the behavior appears in new settings during probes, but disappears shortly after reinforcement is thinned or prompts are faded. This is common in poorly faded programs. A frequent exam scenario describes a skill that works across settings but disappears days after services end. If a skill transfers but stops after reinforcement is reduced, the issue is maintenance, not generalization. The opposite can also occur. A behavior may persist over time, but only in the original training context. This reflects narrow stimulus control. A common trap is assuming the skill is effective simply because it's maintained. If a behavior lasts but does not occur outside training, the problem is generalization, not maintenance. This comparison is critical for exam success. Generalization focuses on where behavior occurs. Maintenance focuses on when behavior persists. The wording in exam questions is your biggest clue. Different classroom or caregiver points to generalization. Weeks later or follow-up assessment points to maintenance. Programming implications also differ. Generalization requires training across contexts. Maintenance requires fading and natural reinforcement. Use the where versus when rule consistently. Learners confuse these concepts because both occur after acquisition. Terms like behavior continues can apply to both, which increases ambiguity. Another issue is focusing only on whether behavior works, without analyzing what dimension changed. On the exam, slow down and ask, did location change? Did time pass? Working in one new setting is not enough evidence for either concept. Here is the decision rule you should apply on every exam question. First, identify what changed. If the change involves location, person, or materials, you are dealing with generalization. If the change involves time passing or support being removed, you are dealing with maintenance. Apply this rule consistently to eliminate distractors. Time practice helps build fluency with this discrimination. In this scenario, the client uses a visual schedule in the clinic with an RBT. However, no data are collected at home, and the parent reports the client does not use the schedule there. The correct interpretation is a lack of generalization. The skill has been acquired, and there is no evidence of time-based loss. The key change is location, clinic to home, which signals a generalization issue. Here, the client masters shoe tying in the clinic, but the behavior stops 2 weeks later. No post-fading data were collected, and reinforcement was not thinned gradually. This is a maintenance failure. The exam strategy is to look for temporal language like weeks later and references to fading or service termination. An effective exam strategy involves 4 steps. Read for change, condition, or time. Ignore irrelevant background details. Eliminate options addressing the wrong dimension. Apply the where versus when rule. Time drills help build speed and accuracy across mixed domains. Programming for generalization and maintenance must begin early. Generalization requires training across people, settings, and materials, and using multiple exemplars. Maintenance requires systematic prompt fading, reinforcement thinning, and a shift to natural reinforcers. The exam often rewards answers that demonstrate planning, not reaction. Ethically, short-term gains are insufficient. BCBAs are responsible for ensuring skills transfer and persist in natural environments. Failing to plan for generalization or maintenance is a breach of professional responsibility. If a plan lacks durability or real-world effectiveness, it is ethically inadequate. These concepts appear in scenario-based questions that test judgment, not memorization. The correct answer must address the specific failure, generalization, or maintenance. Distractors often sound plausible, but target the wrong dimension. Generalization is about where. Maintenance is about when. Both must be programmed and assessed independently. The exam tests discrimination, not recall. Always ask, what changed? Read carefully and identify the tested dimension. Do not assume success without data. Eliminate mismatched options. Think like a BCBA, not like a technician. Your final step is practice. Build fluency with exam-style questions, strengthen discrimination between generalization and maintenance, and develop confidence through time drills and error analysis.